FM with none other than me, Nortey by nature. Palm Sunday edition. So we will indeed make a triumphant entrance into your homes, your cars, wherever you are. Thanks for logging on. But let's get into that Hosanna mood with Koda. I'm laying hands from here. I decree and declare a triumphant entry. But as you know, this and every Sunday, 2:05, we come alive. It's called Ultimate Health. Some call it a program, I call it a promise. Some call us a frequency, I say we are a family.
You know it's another OPP.
Yeah, March 20th was observed as World Oral Health Day. Today I have a family in the studio. Yeah, we're marking World Oral Health Day. Another theme, a happy mouth is indeed a happy body. Trying to, build the bridge. Establish the bridge between your oral health and your overall general well-being. In the studio from Platinum Orthodontics and Advanced Dentistry. If I get it wrong, I'm in trouble. But it is a mouthful. And I'm not playing away. Dr. Yao Asamoah Edu is a principal dentist with Platinum. Dr. Josephine Kwachi is a general dentist with Platinum. And Dr. Bennett Edu is a restorative specialist with Platinum Orthodontics and Advanced Dentistry here in Accra. Yeah, if you know the Airport Hills area, just a hop from the Lister Hospital. They're in the studio to educate us. A happy mouth is indeed, a happy body. Lady and gentlemen, you're most welcome.
Thank you very much.
Since you're a dentist, I'm checking your smiles, or mechanics don't work on themselves.
Oh, no.
They don't work on their own cars.
We work on each other.
Really?
Yes.
You get to do that for colleagues?
Oh, yes.
Oof.
Yes.
Charlie, my mouth is a gated premise for trouble. So me and dentists, we are some way. But you're most welcome from Platinum.
Thank you very much, sir.
One of our topmost dental practices in Accra, and I do indeed believe internationally recognized and acclaimed as well. So you're welcome.
Thank you,
I
sir.
couldn't have made a mistake bringing you into the studio. So this theme, a happy mouth, is indeed or is a happy body. Can one of you just explain what's the thrust? What's the understanding there? Mouth and body.
Okay, so again, good afternoon. Good afternoon to your wonderful listeners. It's good to be back. It's been a while since we've been here, but you're right. In your introduction, you said so rightly that what we are trying to do is build a bridge between the mouth and the rest of the body. And that's important because a lot of the time, we almost consider them two separate aspects of our well-being.
Right.
We think, oh, my mouth, it's fine. I'm concerned about my blood pressure, but my mouth, I don't have any pain.
Indeed, the dentist is not a doctor.
Yes,
right? That's how we see it, okay?
Yes.
When we are in pain, we have all those, cavities and all those painful stuff. Yeah, we can run to you. But other than that, you are not a doctor.
Exactly.
So this bridge means that you are indeed concerned about our general health and well-being.
Extremely so.
And the theme seems to suggest that we can actually predict your general well-being from what we see in your mouth.
Very much so. Very much so. What we will find is, and again, I always like to start with this definition by WHO concerning health, in that health, as has been defined by them, is the state of complete physical, mental, and social well-being, and not just the absence of disease. That's key, because once you start to think of your health in that way, you really start to appreciate all the little elements in your life that actually could be contributing to the absence of health.
Right.
Yeah.
Okay. So we're making these linkages, and that's why we've got you guys in the studio, right? And for many of us, please, we don't want to know this linkage, but this observation gives us the opportunity to do that. So what exactly is the link? Let me ask the only lady in the studio. Dr. Kwachi?
Yes, sir.
Yeah. Oh, don't call me sir. I'm Nortey by nature. Okay. But explain it for the benefit of our listeners.
Okay. So most of the time we have different oral diseases that actually affect the rest of your body.
Okay.
But people may not think of it that it's from my mouth.
Okay.
For example, gum diseases have a very, very strong link to diabetes, wound healing, and things like that. Also, some infections, even in the top of your teeth, may affect your sinuses, and you see that maybe there's this constant cold that is always bothering you. And then when you get a tooth, it's like, oh, I'm okay, and things like that. Sometimes even the pain or the anxiety from feeling that you have a bad breath could affect your confidence, could make you feel a bit depressed, a bit anxious. So as much as
bad breath could affect your esteem.
Yes, your
confidence.
esteem, your confidence. It may make you a bit more tugged in. You're not you don't want to go out there. So I think that it affects your life in general. And what I know is that dental pain can be very, very debilitating. It can wake you up in the middle of the night, and you are the first person to get to the dental clinic. You're there at 6 and they're opening at 8, but because you can't take it anymore,
Right.
and you don't want to disrupt your life
Okay.
so much just because of your teeth. So
Okay.
it's important that we take a look at those things as well.
So, can I say that then my what dental whatever hygiene, my dental health is a predictor of my general overall well-being.
Yes, definitely.
So if there's something wrong with my system, you guys can pick it up in my mouth.
Yeah.
There
Yeah.
are telltale signs, indications,
Yeah.
presentations that are related to overall well-being.
There's if I look in your mouth and I see a certain ulcer, I would tell you to do an HIV test, because this will only
Please,
happen.
Use another example. Not my mouth.
Someone's mouth.
Looking to whose mouth?
Someone's mouth.
So certain, because
Yeah.
you have oral thrush and all those
Yes,
things
yes,
related
definitely.
to some of these-
Candida infections,
Right.
viral infections, herpes virus has a lot of oral manifestations, and once we see it in your mouth, we want to just investigate further and be sure that there's nothing going on systemically. Even sometimes your anemic conditions can be told by looking just into your mouth to tell how red it looks. Vitamin deficiencies we can tell from your tongue, and all of that. There are lots of things that we can tell from looking in your
Okay,
mouth.
folks, if you just tuned in, 14 minutes past the hour of 2 on Joy 99.7 FM. The program is Ultimate Health, your ultimate guide to healthy living. This and every Sunday, 2:05, we are indeed alive. And if it impacts on your health and your well-being, we'll bring in the professionals, the practitioners into the studio to inform you and ultimately transform you. Today, I am drowned in practitioners from Platinum Orthodontics and Advanced Dentistry practice here in Accra. And so we have the men and the women in the studio. Any questions, concerns, experiences? WhatsApp is 5511 We're live on Facebook and YouTube, and shortly I will activate the phone lines so that you can get in on the discussion. Okay, so great linkage, right? So does that suggest, let me ask Dr. Bennett, two Edus in the studio. One with a very, is your voice baritone?
Low
I've
baritone.
written you down for radio, all right? Because I'm looking for somebody to sub when I'm not around.
I'll be reporting,
yeah.
sir.
So tell mom that I bought you. All right. So Dr. Bennett, so this linkage makes sense to you guys, right?
Absolutely.
We are supposed to see you guys, all things being equal, at least twice a year, albeit reluctantly, right? But so this dental or oral hygiene and wellness, right? And the bridge, she's explained it, but what should I be doing really to make sure that I'm on tip top when it comes to this linkage and anything that can be seen, identified, and then further investigated by the dentist?
Okay. Thanks for the question. So, increasingly, we're seeing that individuals are getting medical checkups.
Okay.
They're checking their blood pressure. They're checking their sugar. They're checking their weight. So while you do that, what the next thing you can do is to also check your mouth. Okay. And there's one thing I tell my patients: know your mouth, and that's a good place to start. What I mean is, see the dentist. Okay. You know how your body is. If someone has high blood pressure, they know.
Okay.
If you have a scar here, you know. But what about your mouth? Okay. Do you know the tooth at the back? Do you know how it's looking like? Do you know how your gum responds to tartar? Tartar is a yellowish white stuff on our teeth. Do you know how you're able to fight decay? Okay.
Right.
So once you get to a dentist, typically we'll do an exam. We'll let you know what is where. We'll let you know what you're at risk of developing.
Okay.
And then once we're able to get that, the first thing we look at is to just prevent disease.
Okay.
That's the first thing we try
Right.
to do. Okay, because again, there is the link. And when there is disease, it's disease in the mouth, it can affect the rest of the body. Disease in the body can affect the rest of the mouth.
Okay.
So first thing we do, we identify things that are early. lets you know what your mouth looks like, and then basically we advise.
Okay.
And we recommend that once you've had your first visit, try and make it a habit. See the dentist twice a year. We really recommend that every 6 months you do that, because things change.
All right.
Things change, a lot happens, and it's an area that you have to maintain.
Okay.
Yes.
No
So that's-
condition is permanent, even if it's a good condition, right? And
Exactly.
Dr. Samuel, let me ask you, because it seems to be the case that then we should be in the business of regular dental checkups, right? Not just because we have pain or discomfort or anything else, right? From what the two, your two colleagues have said, it means that irrespective of your health status, see your dentist.
That's absolutely true, Nortey, because what Dr. Bennett just said is crucial. You have to know your body. We know our cars when we have cars. You know when you see a scratch on your car, you're like, where did this come from? Because you knew it wasn't there before.
Okay.
A lot of the time, we look into our mouths and we are strangers to our own mouths. I can't tell you the number of times. What we do at Platinum is, one of our things we do in our examination process is that we do a 3D scan. And then we call it taking a tour of your own mouth. And I can't tell you the number of times I've done a scan for a patient and then they say,
Is that my mouth?
is that my mouth?
Nanka Windi.
But it's true, because for them,
You go through a patient's oral scan
yes,
with them.
You get to see your teeth, you get to see what the gums are like, you get to see all the rotations of your teeth, the cavities, if there are any, the plaque buildup, you get to see
The misalignment.
all the, but it's important because then the patient starts to appreciate that this is a part of me. Because sometimes we think of our mouths as it's a tool we use. We use it to chew, we use it to talk,
Okay.
but it's not really a part of us.
Right.
And that process starts to get you into that process where you integrate the mouth into being a part of you. So you start to think, okay, so this is my mouth, So it's important that you know your mouth. It's important that you know, like Dr. Bennett said, when something changes.
Okay.
I love it when my patients come to me and they tell me, Dr. Yao, this wasn't there before. It tells me that this is someone who is active about their oral health. They are thinking about the changes that are occurring to them in their mouths over time. They are looking into their mouths. Many of us, the only time we look in our mouth is when we brush our teeth. And even then, sometimes we're in a hurry, So that is a crucial part.
Right.
But then also, like he said, you need to see your dentist regularly.
All right.
When you come to Platinum, what we always try to do is that some people show up and say, I'm coming for a clean, it's 6 months. And I'm like, no, you're not coming for a clean because it's 6 months. You're coming for a routine checkup because it's 6 months. You may have a clean done, but you may also have other things done.
Okay.
So the key thing is you're coming in for a 6-monthly checkup, but you may have it clean as well. So we are always trying to make that distinction because we need to get to the point where we think of it as a routine part of our lives.
Okay.
I go and change my car's fuel, oil. I go and go my dental checkup. That's where we want to get to.
Wow. Living and learning on Joy 99.7 FM, Ultimate Health, your ultimate guide to healthy living. We're celebrating World Oral Health Day under the theme, A Happy Mouth is a Happy Body. We're trying to, with the assistance of the specialists and practitioners from Platinum Orthodontics and Advanced Dentistry, to make that link and bring that awareness to you. Don't just go for a procedure. I got one here from Yana in Kaneshi. It's asking what are the side effects of teeth whitening and how often can you do it. Is it once in your lifetime, or once you start, you'll need to do it every year or something? So this is, I don't know. Correct me when I toss it over to you. This sounds very cosmetic, okay? I've been wondering, and I've done this for several years. People say, are the teeth really supposed to be white? And if they are, then I have a problem, right? But this person is talking about something which to most people sounds just purely or primarily cosmetic.
Yeah.
But you are linking all of these professional services and procedures to your overall health.
Yes.
So if my teeth are misaligned, you're not just going to align them for me and do balancing as well. You are also concerned about what indicators you're seeing in my mouth and relating them to my overall well-being.
Exactly.
I may very well be ignorant of that.
Yeah.
So regular dental checkups, thorough, comprehensive, non-negotiable. That's what you guys are saying.
Yeah.
Absolutely non-negotiable.
Is it only non-negotiable when you come to Platinum, or that is the deal?
That should be the deal. it should be the
It's
deal.
not you guys being too known.
No,
Right?
at all.
And
at
looking
all,
for money.
at all. Ah. No, it really should be
Okay.
policy, because what you find really is that, and this applies to health, and actually you realize to life.
Okay.
Anytime you put something off, it tends to become more expensive.
All right.
And it's the same thing when it comes to your health. You have a small ulcer, you don't get it checked, it starts to get larger, you are dealing with a more complicated situation.
All right.
And the same thing when it comes to your teeth. You start to notice some sensitivity. You think, oh, it's going to go. But then it doesn't. Then it gets to pain. And you have to realize that when we are listening to the history of a condition, we are tracking how it's developing over time.
Okay.
And so really what is happening is your body has been telling you there's something wrong here, but you were so busy, life was happening, you couldn't get time. Then it tries to draw more attention. Usually by the time you turn in, because at that point it is unbearable, one, it's disrupting your rhythm of life, like Dr. Kwachi said, but also it's now significantly more expensive to correct.
Okay.
Yeah.
Right. 23 minutes past the hour of 2 on Joy 99.7. This is getting very, very, very interesting, and should I say revealing, right? You might not want to go to the dentist because you're fine. You're eating okay. You're drinking cold, hot drinks, no problem. Nobody has told you that there's a coming from your mouth and so on and so forth. So you're fine, right? But alongside this theme and with the kind of path we're, carving for ourselves, some might say, well, are they going to be doing the what do you call it, the regular how to brush your teeth and all these routine things that we hear ad nauseum, right? We're tired of hearing them. But is it related to this whole happy mouth, healthy body? Should we be now hearing alongside this theme that this is the way to look after your teeth, this is the way to should I say prevent the conditions, and this is the way to protect and maintain your oral health? Is that also an intricate part of this theme that we're talking about?
Yes, definitely. I would say that, because it also a platinum as part of our visits every 6 months. After we clean your mouth and all that, we actually set aside time to go through oral hygiene instructions for you, that this is how you should brush. Because people brush, everybody has a way. Somebody will say that I do this, I use a stick, I chew a sponge, I feel that the manual toothbrush is not really brushing my tongue. I like to really feel that my mouth is clean when I'm done brushing.
There must be pain, there must be
yes,
blood.
like yes, it has to be aggressive.
Industrial brush.
Yeah, and things like that. And someone says, I really like smokers. And I'm like, you're not smoking. Why do you need a smoker's toothbrush? But yeah, we try to talk to patients a lot about maintaining
Even adults?
their hygiene. Very, very much. Yes, everybody that comes to will tell you that, especially after the exam, we can notice some areas of concentration that may be at the back of your teeth.
You're not doing a good
Maybe
job.
yes, the back teeth at the top are not getting as much attention. You are cleaning the outsides of your teeth, but the insides are telling a different story and things like that. So we always try to note those areas. We sometimes even disclose for you with a tablet to show you some colors of where the plaque is a bit more and where you should brush and all that. And we always try to let patients know that prevention is important to us. As much as we will make money if you have a cavity and you come, and it's also our core duty to let
Serious,
you prevent dental disease. And we try to put in sealants, we try to talk to you about different fluoride treatments and things, like, just so that you don't get to a point where you have a cavity. I always tell my patients that I'll be very embarrassed if you tell someone I'm your dentist and then you have so many cavities in your mouth. It's like, what's she doing? But
Wow.
we really take pride in like making sure that our patients have good oral hygiene
Right.
as they come in.
Okay, so we have to keep on hitting on how to maintain your oral hygiene, how to look after your teeth, right? For many people, this is all about teeth, right? But there are many structures in that space.
Exactly.
And you guys are, the captains of that space, really. And you keep on hitting on this. And you're suggesting that even for adults, when they present, you go over
Yes.
this education again.
Yes.
And you're suggesting also that you can look into my mouth and show where I am not even doing the job at all. Right?
Exactly.
And this may be related to my lifestyle, my habits and things I do, etc.
Yes.
Okay, it sounds like no holds barred, Doctor. I hear him call you Dr. Bennett, right? But your surname is Edu.
Edu. Yes.
But he calls her Dr. Kwachi.
It's confusing calling him Dr. Edu because then I think
Oh, okay.
Yes.
Okay, all right. So these kinds of things. Are there some errors, or should I say, areas where typically, from your experience, people don't do a good job?
Okay. So yeah.
In terms of maintaining your dental and oral hygiene, are there areas? Can you give us some tips on things that definitely you should be getting right, and how to get them right?
All right. So when we clean, usually probably standing in front of a mirror or not, the parts that we easily see, okay, we easily clean. Okay, so most people put their teeth together and then show their teeth in a mirror and then pass the brush around. Okay, so that's on the surfaces of the teeth that face the outside. That's other people see. Yes, but then a tooth also has surfaces on top. That's the chewing surface.
Okay.
And then behind where the tongue is always touching. So behind where the tongue is always touching is one area that's really, really important. You need to get your brush in there.
Okay.
Another common area is the bottom teeth. Okay, so the bottom teeth, just behind the bottom teeth where the tongue touches, they tend to accumulate quite a bit of the tartar or the plaque. Okay, that's mainly because our own saliva sort of contributes to the plaque, and saliva really opens up somewhere there. So that's an area that's also quite difficult to clean.
Right.
And then the other place is just reach the back. Okay, whether it's the front, the back, the sides, really, really reach the back. Wisdom teeth are the last teeth to come out usually, and sometimes they don't come out fully.
Right.
Or they come out in such a way that is difficult to reach. Okay, you really need to get them, and that again brings us to the 3D scan we do. Once we do the scan, you see for yourself the areas where you are struggling to reach. So even though these are general areas, depending on someone's brushing habits, they might have specific areas related to them. Okay, and then we point those out.
So you point them out and then teach me how to do that.
And then coach.
Properly.
Exactly.
Okay.
Exactly. And then we coach. For instance, the bottom teeth that I'm talking about just behind, what typically works is that once you've cleaned your teeth, gone over, it's a hack that I give some of my patients. Just rinse the brush, okay, so that there's no toothpaste on the brush, and then look into the mirror. You can see really well, okay. There's no foam in your way. And then you just get the brush behind, really open wide, and then just clean that surface, and then you're seeing what you're cleaning. Wow. So we give specific tips also for specific areas.
Okay.
Yes.
All right. So you should know what you're doing in your own mouth, right? And whether you're doing it properly. It's not just back, right? It's not just a box you take in the morning or in the evening and say, I brush my teeth. And so the dentist helps you, firstly, by conducting a proper, thorough examination. And I heard Dr. Bennett, okay, I've changed to that now. You say the back.
Okay.
We talk teeth. So the back, are we talking about the tongue? Are we talking about the back of the throat? Should I, push the brush back there? And then that's the one, that, the way you start to gag and hustle, right? But you heard Dr. Bennett on radio. He's a specialist, and he says the back. What are we talking? Are we talking about teeth? Should we be brushing or cleaning some of these very sensitive areas and structures?
Oh yeah. So the back, definitely the teeth, and then definitely the tongue also.
Tongue. Okay.
Yes. So the tongue is like a towel. Once it gets to the back, it's a little bit rougher, and it can really trap bacteria. Okay. So it's really important to get to the back. Sometimes a brush can do it well, and usually we'll recommend the tongue cleaner.
Okay.
So they are just some tools that can really clean the back of the tongue, shaped like a spoon sometimes.
Right.
It's difficult when you start. Once you go to the back of the tongue, so you bring your tongue out, take the instrument in, apply it on the tongue, and then you scrape out. It's as if you are raking.
Sorry, I'm being a bit pernickety about this. But this is without toothpaste when you're using this tongue cleaner or scraper.
Yes.
No toothpaste.
You don't need the toothpaste for that.
Now you're doing proper zoom line. And you're scraping stuff. And you're supposed to.
Yes. It helps clean the back
on
of
a
the
daily basis.
Once a day at least.
Scrape my tongue.
Yes.
Folks, me, I won't confess. So I'm going to activate the phone line so you can confess whether you've been doing what the practitioners in the studio suggest. They're coming from Platinum Orthodontics and Advanced Dentistry. Serious guys. They're not kidding at all. And when they say they will clean your mouth, don't even ask whether it was dirty. Allow 0302216541, right? 0302216541. Ultimate Health on Joy 99.7 FM. We are live on Facebook and YouTube. Fingers crossed, right? There's been some disturbances with the internet and all that, but we're live on Facebook and YouTube. Get your questions in WhatsApp 055 1111 997. Today they are here. They are not charging consultation, right? So hit those buttons and send those WhatsApp and ask the questions, and I'll get them to respond. This one says, you read out my question, but it wasn't answered. This is the one about whitening of teeth, huh? And whether you do it once or it's for a lifetime. Hang on to that. Let me read a couple more before I get into trouble. Okay, the other ones. Okay, there's requests for another program. So this whitening tooth whitening or whatever it is, are you bleaching? Are you painting? What do you do? And does it also affect you? And do you do it once, or once you start, you do it forever and ever? You know, you top up.
Okay, so tooth whitening has become a very interesting procedure that everybody's interested in. So what we're actually doing is that we're removing the pigments, the colorful pigments in your teeth. I usually tell my patients that everyone should think of their teeth as a white sheet that you own.
Okay.
With time, you are eating with the teeth, you're having palm oil, you're having coffee, you're having sobolo, you're having different things with your mouth all the time. So it's just like wearing your white shirts a lot. So as you wear the shirts, definitely it's going to lose some color over time. So what you are doing by brushing your teeth and coming in for your dental cleaning all the time is just like washing your white shirts.
Okay.
Now, if you want to restore the whites, you put your white shirts in bleach. That's what tooth whitening is doing.
Okay.
So technically you are bleaching your teeth
bleach
with safe very, very safe materials like hydrogen peroxide, but just a higher concentration.
All right.
So that's what tooth whitening is doing.
You're not doing it yourself. You've got a trained professional,
Yes.
fully qualified,
Yes.
doing this.
That's a very important part.
Okay,
Yes.
because you know my people, they'll go and buy the hydrogen peroxide
Yes.
and do their
It's
stuff.
not your bottle with hydrogen peroxide. Yes. So
Okay.
this is a very high concentration which a professional is leading you to do either at home or in the clinic.
Okay.
Now, she's asking about how long you should have to do it every year and things like that. The longevity of your tooth whitening is maybe 90 or 100% you, because if you've bleached your white sheet and you are wearing it once a month, or you are trying to take care of it every time you wear it, you make sure that you're not going to a dusty place.
Okay.
You are making sure that you are wearing it and keeping it clean, rolling up your windows and things like
your
that.
practices will also determine
Yes.
your lifestyle, your
Yes,
habits.
Yes, but if after my whitening you go and have a benkwai, it's not going to last for you.
I was starting to get to like you, but I'm wondering. All right. Hello. Good afternoon.
Yeah, hello.
Yes. Who's on the line?
I'm Steve.
Pardon?
Steve.
Steve.
Yeah.
Okay. Right. Steve, share with us, please.
I'm really enjoying the discourse so far, but I wanted to know for a child who has just started getting teeth, if there is any time limit or time frame for the mother to start brushing the child, and what method is suitable for the child.
Okay. Brand new rubber shahun teeth. A child, a baby.
Oh, okay.
Right?
Okay.
New teeth.
Yeah.
Okay. When should the mother start brushing, or let me use cleaning these new teeth, right? That's what the gentleman is asking, all right? And the phone line is active. There's another caller. Hang on to that. Hello, good afternoon.
Good afternoon, Nortey.
Hi, this is Oti.
Oti Watson from
You're welcome,
Selma.
my brother. Share with us quickly.
Yeah, my greetings to you and your panelists and your doctors. Now, to the doctors, we should add the dentist to our budget too every year. And now to ask two questions. My first question is, you can see someone have a white teeth. While the person is speaking to you, you can see the scent from his mouth. What comes from what is the case of that? And my second issue is that
hang on, Oti. The person has white teeth, but there's still
yes, when he's speaking to you, he's blowing
okay.
some teeth and
all right.
the scent is not proper for you.
Okay.
Yeah. And I don't know where it's from the teeth or from his head or I don't know. So I the doctor to explain. My second one is the teeth cancer. Somebody told me that somebody has a teeth cancer. The teeth cancer, what brought the teeth cancer? It's not proper fix or there's a hole under the teeth. That's what brought the cancer. What brought the teeth cancer?
All right. Thank you, Oti. Oti Boateng in Tema. All right. So we've got the one about cleaning babies' teeth, new teeth. And then he's saying that you can have somebody with perfectly white teeth, right? But there's a mouth odor, right? And he's figuring, where's this from? If the teeth are white, I mean, please. And then where's the odor from? Where's it coming from? Your head, your mouth, or where? And then lastly, he asked about cancer or oral cancer. He said cancer of the teeth or the tooth, right? So who wants to take the baby? When should mommy start cleaning babies' brand new teeth?
Okay. I think it's advisable to start cleaning the teeth as soon as they're coming through.
Okay.
And you just need a very, very tiny amount of like a pea-sized amount of toothpaste.
Right.
Children's toothpaste. Also because you don't want them swallowing the toothpaste and all that, because that could be fluoride, excess of fluoride can
Children's toothpaste doesn't mean the size of the tube, does it?
No.
It means what the constituents.
It's a specific formulation for children.
Exactly.
Because sometimes children may not be able to always spit out and they may swallow it. So we need this type of toothpaste that are safe to swallow for children.
Right.
We also want to encourage toothbrushing. So some of these toothpastes are relatively tasty. So the children will be excited about brushing. You don't want to give a child a bitter tasting toothpaste. So these toothpastes are fine. We also have these new finger brushes. It just fits on the mom's finger, and then you can just use your finger to brush the child's teeth and then just clean
as
up
soon as you should start this early.
Yes, please.
You're not waiting for it to be.
No. And
how early is that?
This is by 6 months.
By 6 months, you should be cleaning
2 bottom teeth.
All right. Since we're in Ghana month, our moms used to use tomatoes and other things to clean our teeth. Is there any clinical or scientific basis for? Does it do anything? Does it protect, or is it also tasty?
I'm not sure about the tomato, but I'm sure that it has. Some people use glycerin as far as on a towel to clean the teeth, and everyone has their methods. But we will recommend a children's formulation toothpaste.
Right. Toothpaste, all right.
Because we are also trying to incorporate fluoride into the new teeth, and that is found in these toothpaste to make the teeth stronger.
All right. White teeth, bad breath, cancer, oral cancer. Which of you is taking that?
All right. So let me take the white teeth but bad breath.
Let me stick in there. Does white mean clean?
That's a good question. That is a good question.
Okay.
And that's what I was going to say, because one thing you will find generally is that a person's color of their teeth is largely genetic. Not largely, and some of it is sometimes it's just perception as well, so people always say, oh, you seem to have white teeth, or I was like, yeah, but it's against a dark background, so
you're dark, so
yes,
all
but
right.
The color of your teeth is no bearing necessarily on how clean your teeth are, or even how clean your mouth is, and that's really what we should be thinking about, because the mouth, like you rightly said earlier, is the teeth, yes, is the gums, is the tongue, and many other structures in there. So the presence of an odor in the mouth, while it may come from the teeth, in that you may have a cavity, you may have some issues in there with areas where there's food staying in the mouth, when you clean, it may not necessarily come just from the teeth. Your tongue may not be cleaned adequately towards the back. You may have some issues coming even from the gastrointestinal tract. You may have issues, gastric reflux, which could all affect your ability to have a nice smelling breath.
All of which should be properly investigated.
All of which we properly investigated.
Right.
And that's why the theme is so crucial.
As
because
Ghanaians will say, it's not just hearing the scent.
it's not just hearing the scent.
Uh-huh.
You have to look at
Don't use your ears and say this and that, please. This is not sound.
Very important. And what I
Right.
find sometimes is the frustration some patients have when they come to you and they say, you know what, doc, I'm cleaning 3, and oftentimes such patients, they will be cleaning multiple times in a day, cleaning their teeth
Some
multiple
OCD
times.
comes in there. yeah.
Exactly.
Mhm.
And they are saying, I'm doing all of this work, why do I still have this smell? And then you really have to start to think, okay, have you consulted a gastroenterologist, to find out what's going on in
Alright.
your GIT? Have you found an ENT surgeon to find out what could
Okay.
be going on in your sinuses? You have to consider
So there
all
are
of
multiple antecedents
Multiple-
or possible causes
Exactly.
of bad breath. It
Absolutely.
must be investigated.
these. You must investigate it.
Whoa.
And in a few cases, it's purely psychological.
I knew you were going to toss it over. Right? Good afternoon. May I please know if there's a worm that destroys our teeth? Or is it due to our own negligence? Worm that destroys our teeth. Huh? Which of the toothbrushes is good for us to brush our teeth? Smooth, medium, or rough? Huh? So he's talking about the type of bristle, right? And the texture, right? Is that the classification? Smooth, medium, rough?
He's teaching us a new one.
He's teaching. So what's the classification, and does it have any bearing on its efficiency in cleaning our teeth?
Yeah, so the bristles could
That was
typically.
from Jojo in Athenia.
Okay.
Yeah, go ahead.
Yeah, so it could be soft, medium bristles, or hard bristles.
Okay.
These are largely designated by the manufacturer.
Okay.
Okay, so they definitely make a difference. Soft bristles we usually want to use for children. It's
Okay.
more comfortable for them so that they don't resist the brushing. Adults can use a soft or a medium. Okay. And then hard ones we don't recommend because they can cause quite some damage to the teeth. Okay. Now, when cleaning, the brush is very, very important. Okay. I could say even more important than the toothpaste because the main tool it's the
It's the
toothbrush.
toothbrush. Okay.
Exactly. The toothpaste is helping you clean, it's giving you a fresh breath, and then it's fighting bacteria. But getting the bacteria mechanically off your teeth is the toothbrush.
All right.
And the motion that we want is a sweeping motion. Okay, we want you to think of brushing your teeth as sweeping what the plaque on the plaque is just the bacteria, as sweeping it off. Okay,
Right.
rather than scrubbing it off. A hard brush is probably doing scrubbing, okay, especially because the bristles can't really bend to sweep, so you're likely to just go across the surface, okay.
Alright.
So a soft to a medium really works well.
Okay.
Now, what works better than a manual toothbrush will be an electric one. Okay. So electric toothbrushes, they clean better.
They clean
so,
better.
Yes. And they are either using a rotary motion, like turning. Okay. So you put it against a tooth and then it's turning and it's doing the clean for you in a way that doesn't hurt the gum and doesn't scrape off the surface of the tooth. Okay. So those definitely clean better, and then some of them come with a pressure sensor.
Right.
So if you're cleaning too hard,
it
you
tells
get
you.
a beep or you get a light, and then you can just be gentle on those areas. Yes. So we recommend soft to medium bristles.
Okay.
And again, these are general. We always want to make a recommendation that is specific to an individual.
Okay.
But medium, soft,
So
and
these
then
are
we teach you the
general
right
recommendations, but once you've been seen, we can now tailor
Definitely.
the recommendations
Absolutely.
to your challenges.
Absolutely.
All right. So there's prior honey ho. You see, you can have a broom that is really, 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 really firm and should I say harsh, right? So get these things, and the doctors are suggesting to us that it's not really that; it's how you use it, and whether you are causing harm, right, or you are actually cleaning your teeth, right? If you have any questions, WhatsApp 055 11 11 997. There was one about the cancer, but let me read out a couple more. You note them. Good afternoon. Which is best, keeping your natural teeth color and keeping a healthy oral hygiene without any odor? Good technical brushing and food particles removal is a must. So the which is best? So perhaps the person is saying keeping your natural teeth in terms of color, right? But doing the right things, right? And avoiding all the odor and all those things, right? Against, I guess, bleaching and chasing, whitening and accepting prejudice. Can I say that?
Yeah.
Chasing white, is it a prejudice? Because Doc Yao said that, well, our color, the color of our teeth is predetermined, kind of, right? But of course, you may want to approach a certain desired point. Okay, right. So that's what the question was. That was from FM in Prampam. This one says, whoa. Good afternoon, Nortey. How are you and your guests? After church, I sleep a little and I'm not able to listen to the beginning of this educative program. To something when I listen carefully, I could hear you are talking about teeth. Oh dear. Hayford in Bato, can you send that again? I can't decipher properly, but he starts to listen when we've done much of the talking. Norte, please ask the doctors, what is the right way to clean a baby's mouth? We've just talked about this. Can you use a toothbrush and toothpaste? Yes. Doc Kwachi said that there's kiddies toothpaste for children, specially formulated, and that's not to do with the size of the tube, okay? It's how it's formulated. I'm using baby's toothpaste for his teeth. He has just 8, but I realized it's not helping. His teeth seem to be discoloring, and the toothbrush also makes him uncomfortable, but he's okay if I use a towel. Any comments on that quick?
Yeah, I think that she also has to look at other factors. What the baby is eating.
Okay.
Is she breastfeeding all the way till he falls asleep? Is she giving him a bottle all the time? Because we usually recommend that for children, at least 1 hour before bed, nothing should be going into their mouth. Are they drinking some water and things like that? So I think that cleaning is essential, but we also have to look at what is going into their mouth, which brings me back to the same white shirt thing. So if we are cleaning and we are still putting things in there, we this.
If I follow you, I probably say don't give the baby a bencoin, but knowing you, she's always smiling. This Doc Kwachi, right? My guests from Platinum Orthodontics and Advanced Dentistry, we're going through a range of things. We may have to brush again with them, possibly next week, looking at the mouthful we have to go through. The theme is happy mouth. A happy mouth is a happy body. We're relating your oral health hygiene to your general well-being and health status, right? And the doctors are suggesting that they can tell you a lot about your general health status, other things that you may not be aware of that may be going on in and with your body, right? Just by virtue of conducting a thorough oral examination, they can advise you on many things. Yes, Dr. Yao.
Yes, so I just wanted to make sure we didn't forget the question about the teeth cancer.
Yeah, I'm coming back to that.
All right, perfect.
Okay.
Perfect.
Yeah. So we're done on that. Hi. No, this is not. Okay, this is for me. Good afternoon, Norte by nature. Right. Good information you have there. Please, I want to know what I stand to benefit on behalf of my 2 boys. They had white teeth until they started losing the front ones. Soon after the loss, they complain each time they brush. We noticed the browning, and now there are 2 colorings of the teeth. Right? He's talking about 2 boys, but he's talking about teeth as well. We are planning on seeing the dentist. Please help me with what we can do. Zet from Akwiteman. So the kids had white teeth, then they started losing them, and then they started noticing some discoloration and so on and so forth. A bit frustrated and want to know what to do.
This is something you see very often
Right.
in, I don't say first-time parents,
Okay.
but let me say the first-time parents see their children going through what we call the mixed dentition stage.
Mixed dentition.
Yes.
Okay.
What does that mean? Really, what it means is that the stage in your development as a child, when your baby teeth are now falling out and your adult teeth are coming in.
Okay.
Now, please know that, as we've said before, there are many reasons why your teeth may be discolored. From what you eat, even sometimes to how the teeth themselves formed during development. In a few cases, you may have teeth that were, during development, you had some kind of systemic disease, you fell ill, the fever, something.
Okay.
And that can actually affect how the teeth form. And you realize that when these teeth now come into the mouth, they might be a different color from the rest of the teeth.
Okay.
But let's assume all things are normal. You will even notice that primary teeth or baby teeth are generally whiter than the adult teeth.
Okay.
Okay. So whenever you have children who are
They
in
are
this stage,
innocent in color.
they are innocent in
We
color.
haven't tortured them or exposed them to all the insults. Let me use that word. Right. So,
So-
baby teeth are normally whiter.
than the adult teeth.
Okay.
So it is very normal to have parents concerned when you see in the child's mouth, you have usually the front teeth come in first, and then you have they looking a bit yellowish, and then the baby teeth are still on the side, so they still
Looking
look very
white.
white. So it's like, so you're not brushing your teeth, the
And
front
that-
you're not brushing,
That is the mixed dentition.
and that is the mixed dentition stage.
So, are you suggesting it's normal not to worry? Should this parent stop worrying?
Don't worry, but still see a
Still
dentist.
see a dentist.
Because the truth is, as soon as you have teeth, you should start seeing a dentist.
Okay.
Even if it's just for a clean bill of health, you're okay, see you again.
All right.
So as soon as you have teeth, I have parents ask me, oh, when should I start? I'm like, you should have been bringing them already.
Okay.
You should bring them in to see the dentist as soon as they start having
Okay.
teeth.
All right. Once you have teeth, you see a dentist. And hey, that doesn't mean if you don't have teeth. You know me, I'll say it. Right? That might be a reason to go see a dentist as well. Huh? All right. And for the elderly as well, all sorts of things. I'm thinking of like 13 different programs I can do with these guys there. Right? The geriatric, the
Yes.
elderly, they
Yes.
can't chew
Yes.
properly.
Yes.
You think they are stubborn and they are refusing food.
Yeah,
But the food you are giving them, please.
painful.
It's painful.
Yeah.
So they won't eat.
Yeah.
So, Platinum, I'm looking at somebody. Somebody's looking at me in that tone of voice. But we have to do programs
Yeah.
for different categories and different issues. This one says, is this for me? No. Okay. Please, I'm fully dressed up for church. Abek, is this for me? Okay, please, can I have this particular up close words? No, my niece brush. Okay, my niece brushes twice a day, but when she sleeps and wakes up, there's a map drawn on the pillow case, Nortey, by nature. I want to know if there's something wrong with that. This is from Dijo in Dodua. So drooling and whatever. Huh? There's a map drawn on the pillow. So the brushing and all that seems to be okay, but they're worried about this presentation, the drooling. Any quick answer to that?
Well, I mean, just to make it quick,
Uh-huh.
children. I don't know. She didn't specify the
The
age
age,
of the
right.
of the,
Mhm.
of the child, but children tend to drool, and there are many reasons why children would drool.
Okay.
Sometimes it's just because they are falling asleep in a position where it's allowing for the easy flow of saliva out of the mouth.
Okay.
Sometimes it's because they have food in their mouth when they are going to bed, so they haven't brushed properly the night before.
Right.
So there are many reasons why a child would drool at night. It's not
And this
really
must
linked-
be also investigated.
and this must
Yeah.
you must.
Okay.
Some people just salivate a
Yes,
bit more.
a lot.
Right.
So you have to really find out what the possible cause is. Yeah.
Okie dokie. So have them checked out, right? She's 16.
She's 16.
Yeah. Right?
That's a bit old.
Yeah,
A bit old to be drooling?
No, not too old. It's not too old. Like
Much-
a lot of the time, you may actually find that it's linked to the sleeping position.
Okay.
Yeah.
All right. I have a call on the line. Hello.
Hello.
Yes, good afternoon. You're in.
Good afternoon.
Share with us quickly.
Good afternoon.
Yes, share with
Yeah,
us.
my name is Patrick.
Yes, Patrick, you're welcome.
I have a question. My son, he has teeth going in before the milk teeth fall out, and he happens to have 3 rows of teeth in the lower mouth now. And I wanted to know if that is a problem, or they are going to fall out in due course.
Okay, our happiest dentist here is already nodding. So she will take that. She laughs. The other guys laugh, but she has her own way, right? So teeth growing inwards,
Yes,
and
it's-
then multiple rows.
Of teeth, yes.
Hey.
So we call them shark teeth in dentistry because shark have that kind of development in their mouth.
Okay.
That's they have 2 rows of teeth.
Okay.
So the normal development of adult teeth is usually, we call it lingually. It comes a little more behind the baby tooth and then grows in position, and then the baby tooth comes out.
Okay.
Also, it's important to know that when teeth are erupting, when they are coming out, there's a lot of dynamics going on. Something is moving forward, something has come out, the space created, it has to move into the space, and things like that. What I would say is that if the tooth is coming out, let's allow it to come out.
Okay.
If after some time you notice that the baby tooth is still there, quite firm, and the adult one is developing behind it, then that one we have to go to a dentist.
Okay.
What happens if you just leave it? Then the tooth is developing, and then it's not moving into where it's supposed to go.
Okay.
And then now what you end up having is a misplaced tooth.
Right.
So if you come in time and we take it out, then you are given the new tooth space to move into where it's supposed to be.
Okay.
And then that helps. But we see it commonly. His child is not out of the ordinary.
Right.
It's just something that we can solve. And if he brings a child in, if there's a need, we'll have to just take it out.
So you guys are the landlords. You determine who should be evicted.
Yes.
And you determine whether the development of the teeth, the growth is normal.
Yes.
And should be left
Yes.
at peace.
Yes.
Right.
And what time we should take it out? Maybe you come in and we say, okay, let's look at it again in 2 months' time.
Okay.
If it's still not in the right position, then let's take out that one.
Great stuff. Right. I have another caller. Hello.
Hello, good afternoon.
Hi, good afternoon. Share with us quickly.
I'm Ibrahim from Tama.
Danny? Yeah, Danny.
Ibrahim from Tama.
Ibrahim from Tema. Speak up and share quickly.
Okay, please. If I've seen a child's teeth that is not aligned properly, and this is the second. Should I say the second phase? Because the one that came earlier have already gone out already,
Okay.
and the one that is coming, which is more or less the permanent one, is not aligned. Can it be realigned, please?
Okie dokie. Misaligned teeth. Baby ones have gone. The permanent teeth look a bit misaligned or crooked. Can anything be done?
Yes, absolutely. Something can be done. I think this is a good time to chip in something that I really wanted to touch on today, which is, you mentioned earlier how the mouth is a small area, and then we are the ones who oversee that area.
Right.
But the truth is that even among dentists, we are not all the same.
Okay.
So, for instance, what Ibrahim is talking about is a case where this child will need to see an orthodontist,
Right.
Who is a specialist in the field of aligning teeth.
All right.
But then again, maybe if you mentioned geriatrics earlier who can't chew, who don't like food because they're missing teeth or they have issues,
Yeah.
you actually have someone who is a prosthodontist who is a specialist in replacing missing teeth. So there are many specialties.
You're going into the specializations.
Exactly.
Right? That's why I said we'll brush again.
Mhm.
Okay? Because when we put too much in the mouth, then there are challenges.
Exactly.
Okay? So what Dr. Samoedu is sharing is that there are different specializations. Okay? And it could be that you may be presenting to the wrong specialist. They may not have the requisite training and expertise to handle your problem.
Yes.
There are those who do the alignment and all those arrangements. There are those who do replacements and so on and so forth. And they are here in their different categorizations. Okay, we'll get to that next week because I did promise them that I will break things down so we can chew, so that it is bite-sized for you, my discerning listeners. So they are specialists. Dr. Bennett Edu is a restorative specialist. He restores. All right? But in their field, it means something specific. Okay? So we'll get into those ones so that you get to understand. There's another question here, naughty by nature. These days, you guys are getting it right. And nobody's saying or writing naughty by nature.
Perhaps that may be more true.
I have a cousin who he's also naughty doer, but he is naughty by nature. Some people will know that, but I am naughty by nature, so that's good. My son's front down teeth, I like this, are not properly aligned. Can they be realigned? Yeah.
The answer is yes.
Yes.
It can. Yes, and he should also give it time. When children are in mixed dentition, we call it an ugly duckling stage, because at that time it's like some of your teeth. When I see my pictures from that age, I don't like.
When you speak, you started telling some people that what they have is shark teeth. Now ugly duckling.
So we all have those pictures from when we're like 8, 10, where it's like your two front teeth are so in front and you don't look so nice and things like that. So what's, as I was saying earlier, tooth movement is very dynamic between the ages of 6 and 12. I would say that the parents should also give the child time. Let's let all the baby teeth fall out and let's see how it's looking in a stable way by age 12.
Okay.
However, there's still a need to come in to see a dentist or a specialist, because sometimes an early intervention means that by age 12 everything would look nice and aligned. So there's definitely a need to come in so that the dentist can decide that this child needs this at this time.
So actually we can decide what is typical or normal and what is atypical or problematic. But you're saying that the development of the teeth, the arrangement, all that is also should I say, along a developmental continuum.
Yes.
Right? Different ages, different things are happening, things are shifting, and so on and so forth. You probably go and touch something which doesn't need touching. Right? But these guys will still charge you. I mean, I'm kidding. Right? So you should know where the problem sits, the developmental age, the context, and all that. And of course, see the right people as well. Whoa. This one says, which toothpaste? We've gone past time. I'll just squeeze this in. Which toothpaste is best for our health? Does brushing once a day cause bad odor? I don't know whether he's trying to economize on the toothpaste, but he's asking, does brushing once a day cause bad odor? And I guess the person is looking for you to say, this is Douglas from DC, looking for you to say, once cry, why you've done some. And great work and happy Sunday to you and the team. So can we just quickly wrap this one up? Which type of toothpaste, because there are now so many, right? Charcoal and all sorts of cool meaning are coming in. But which type of toothpaste is best for our health? And then this twice daily, edict that we hear. If I do it once, am I in trouble? Am I in default?
Okay, so like I mentioned earlier, remember that the primary tool, for cleaning your teeth is the toothbrush. Okay, it's really, really important. It doesn't mean the toothpaste is not important. It's also very important. Now, would recommend a toothpaste that contains fluoride. Okay, because one very, very effective way of preventing dental decay, which is the most common condition in the world, affecting about half, is fluoride. Okay. So if the toothpaste contains fluoride, it's probably good. Now, some of them do contain fluoride, but they seek to do extra things like whitening your teeth, the charcoal ones. Some might be a little bit abrasive. It's good to just, if you're swapping to a toothpaste like that, you should just consult a dentist. Okay. But the best type of toothpaste that you can use is one that contains fluoride. We want the fluoride to stay on the teeth.
Let's just quickly hit on the number of times you should brush a day.
Oh, 2 times is great.
Assuming you're doing the right thing. Twice.
2 times is great.
Morning?
Night and another time.
Exactly.
I would say night brushing and another time after. So twice, nights and another time. So night and morning, night and afternoon, but do the nights. And then one other time.
All right.
It's the most important one.
The night brushing is the most important.
Yes.
Right.
During the night, you're not producing a lot of saliva. Your defenses against decay are a little bit lowered. Yes. So once you've had some brushing, it's really good protection throughout the night. Yeah.
Great education. A happy mouth is a happy body, but the happy mouth is not a joke. We should be doing things consciously and deliberately. We should have the appropriate requisite information, and we should be seeing our dentist on a regular basis, at least twice in a year. And I've had a whole mouthful from Platinum Orthodontics and Advanced Dentistry, Dr. Josephine Kwachi, the laughing, giggling one, right? She's a general dentist, am I right?
Yes.
Okay, general in terms of giggling and other things, but she's got the information. And then Dr. Yao Asamoedu is a principal dentist.
General dentist.
Principal general dentist.
Yes.
Charlie. It tells you the kind of pain they can inflict, right? And then Dr. Bennett Edu is a restorative specialist. Next week, we'll go into all those things. We'll also get to understand how your oral health and hygiene affects even your mental health.
Yes.
right? All the things that you do that affect your oral health and hygiene, and of course, we'll go into those specializations and the reason why you may require a specialist. All right. One thing I've learned is that hey, some people have shark teeth. And what was the other one you added?
Can be your ugly duckling face.
All of us should go and look for our pictures, whether they are on phones or those Chuchu Blema albums that we used to have, where your teeth were not exactly your best friend, right? And Dr. Josephine Kwachi is suggesting that there are times that, yes, things will be misaligned, crooked, and it's developmentally perhaps okay, though not too attractive or pleasant. So when you want to do something about these things, you need specialists and you need specialist care. I can confidently suggest you can get it with these guys. They'll be back next week. We'll go deep into your mouth, right? Another educative, easy to digest, nutritious edition of Ultimate Health, produced by Abeku-san Kofi and presented by Nortey by Nature. Stick and stay. There's lots more on Joy 99.7 FM. I'm out like that. Palm Sunday. Enjoy.
Joy.